Welcome to our YouTube channel. In this video, we are going to talk about 10 most common myths about mental illnesses. There are many myths prevailed in our society related to mental illnesses. Here we are going to discuss some of them. Number 1 is mental health problems are not so common. Due to our negligence or lack of information, most of us think that mental health problems are not so common, but stats are totally opposite. According to one stat, 1 out of 5 adults experienced a mental health issue. According to National Alliance on Mental Health in 2019, 1 out of 20 adults experienced serious mental illnesses. Suicide is the second leading cause of death among people aged 10 to 34. Number 2 is children don't go through mental health problem. Mostly people think that a child can't have a mental illness. That is not a fact. Even children can show the warning signs of mental health. According to CDC, ADHD, behavior problems, anxiety, and depression are the most commonly diagnosed mental disorders in children. 7.1% of children aged 13 to 17 years have diagnosed anxiety, 3.2% with depression, and 7.4% aged 3 to 17 was diagnosed with behavior problems. Number 3 is mental health problems are untreatable. Mental health issues are treatable just like our physical ailments. With proper treatment, care, and with help of therapies, it can be treated. It is not necessarily a life sentence. Treatment might take some time, but in end one gets positive results. You have to show patience during the treatment process, and the results may vary from person to person depending on his family environment, support system, and his own willingness to cope with mental illness. Number 4 is mental health problems are purely genetic in nature. Often people think that mental illnesses are caused by genetics or are biological in nature. That is not a fact. Though many types of mental illnesses are caused by genetical factors, but our environment also play a major role in it. Life stressors, our ability to cope with stress, our lifestyle choices all contribute to mental illnesses. Number 5 is panic attacks are terminal. Though panic attacks are unpleasant but are not life-threatening. One who has panic attacks may have difficulties in breathing and have racing heartbeat. That doesn't mean they are terminal. Whenever you experience a panic attack, find a safe space and avoid crowded places. Number 6 is therapies didn't work. We often consider therapies don't work and are just waste of money, time, and efforts. While the fact is therapies are helpful as medication in treatment, but it depends on an individual condition. For some, only therapy is effective, while for the others, medication along with therapy proved useful. According to a study, about 70% of people who took psychotherapy recover earlier compared to their counterparts. Psychotherapy brings positive change in behavior of a person. Brain scan shows change in brains of individual who took psychotherapy. Number 7 is we can't prevent mental illness. People think that one can't prevent mental ailments, but it is possible to prevent mental illness. Knowing the risk factors and avoiding to these factors or dealing effectively with these factors can help us to prevent many types of mental illnesses, such as anxiety, depression, and post-traumatic stress disorder. By promoting awareness related to mental health and well-being of youth and children, we can prevent these mental illnesses. Number 8 is personality factors are cause of mental illness. If one is lazy or weak, can't handle his or her emotions, will have mental illness. That is not true. Our personality weaknesses or flaws are not causing mental ailments. There are many factors that can contribute to mental illnesses, such as genes, physical illnesses, brain injury, and chemical imbalance. Our life's negative experiences such as trauma or history of abuse and family history of mental health problems all can contribute to mental illnesses. Number 9 is schizophrenic have split personality. Schizophrenic don't have split personalities. According to WHO, schizophrenia is characterized by distortions in thinking, emotions, perceptions, sense of self, language, and behavior, and person will have delusions and hallucinations. Split personality disorders come under the category of personality disorder and is known as multiple personality disorder. Number 10 is people with mental illnesses are unpredictable. It's true that in some rare cases, patient can be unpredictable or violent, but it is common among patients with severe mental conditions. But in most cases, they are non-violent. Even schizophrenic patients are non-violent. Studies also shows that people with mental illnesses are non-violent and are not risky. So this was our today's video. Thanks for watching. Don't forget to like this video and to subscribe our channel. Up till next video, take care.